Hi, my name is Caitlin Noyes. I'm a nursing student at the University of South Alabama, and today we'll be doing the medication administration checkoff. Here's my ID. And the person recording will now scan the room. Okay, the first thing I'm going to do is verify on the chart in the MAR that by the 5 rights, I'm going to make sure I have the right patient, Jaguar Jones, the right medication, heparin, the right dosage, 5,000 units, the right route, subcutaneously, and the right time, every 12 hours. And then I'm going to check the allergies. I have penicillin, so that's all correct. I'm going to perform hand hygiene. I'm going to go to the medication box and choose the correct medication. I have heparin, 10,000 units for every milliliter, and the expiration date is 12/5/2025. And I'm going to go to my MAR and make sure that I have the right medication, the right route, and the right time. I have heparin subcutaneously every 12 hours, and I have to calculate my dosage. So if I have 10,000 units for every milliliter of heparin, and we're giving 5,000 units, then I'm going to put 0.5 milliliters in my syringe for the medication I'm going to give. So the dosage would be 0.5 milliliters. I'm then going to clean off my vial with an alcohol pad. And then grab my TB syringe. I'm going to remove the cap, place it down. And I'm going to get 0.5 milliliters of air, so we reduce the amount of air bubbles, or hopefully none at all. And I'm going to put this in my vial and put the 0.5 milliliters of air. And then get to my correct medication. So 0.5 milliliters of heparin. Okay, so I have 0.5 milliliters. I then would verify with another nurse that I have the correct amount, and then I would recap my syringe by using the scooping method. I would go to my MAR and check the 5 rights again. Jaguar Jones, heparin, 5,000 units, subcutaneously, every 12 hours. I then would label my syringe by the medication. So we have heparin, the dosage 5,000 units, and the patient Jaguar Jones. And then I would take my MAR and the syringe to the patient's room with me. And when I get to the patient's room, the first thing I would do is, first I have to label my medication before going to the patient's room. And then I would go to the patient's room. And then I would perform hand hygiene. And then I would go over the 2 medical identifications. So I have Mr. Jaguar Jones with a date of birth of August 25th, 1963, and those match on the armband. And then the allergies are penicillin, and those match too, but I have to make sure with the patient. Mr. Jaguar Jones, are you allergic to anything else other than penicillin? No? Okay. And then I would go over the 5 rights again. Jaguar Jones, heparin, 5,000 units subcutaneously every 12 hours. So I have the right patient, the right medication, the right dosage, the right route, and the right time. And then I'm going to raise the bed to an appropriate working height and lower the side rails. And then I would tell Mr. Jones what I'm going to be doing today. I'm going to be giving you 5,000 units of your heparin, and we're going to be doing this in the abdomen. So we're going to make sure we do not go above the costal margin and not below the pubic area. And then on the sides, we're going to make sure that we don't go beyond the superior iliac spine. Then we're also going to make sure we do 2 inches around the umbilicus. So then I would apply my gloves. And then my goggles. And then I would get the alcohol pad And we will find the area first, so we're going to do it at the abdomen. Clean in a circular motion. And then I would get my syringe. And then we'll lift 2 inches at a 90-degree angle, and we'll do this slowly. And then we'll remove that. And then I'm going to put light pressure on around, making sure I don't massage. And then I'm going to recap because I don't have a safety part. I then would dispose of this in these sharp containers. I have this labeled. I then would remove my gloves. And throw that in the trash can. And then I would raise the bed and then raise the side rails, and then also remove my goggles. And then I would write down on the MAR the medication and then how the patient did, and then I would perform hand hygiene, and then the 6th write also on the MAR, and then I would make sure that I would reassess the patient for any allergic reactions.